Good. So moving on to vaccines. Anytime I do give vaccines, I always mention that although vaccines are very, very safe, we do want them to make sure even in the usually in the hour after they're vaccinated, just to make sure that they do not develop any reactions. Most common reaction to a vaccine, sleepiness and soreness, which is totally normal. What would be an abnormal reaction to the vaccine? Face swelling. That's the most common presentation in dogs. Usually happens within an hour or less after the vaccines happen. And if it does, it is very treatable, but go right back to your vet because it does need to be treated through a veterinarian. And if they're not open...
and Gabie and Coco on all vaccine, on prevention medication, they also have Advantage Multi.
Yes.
I gave this twice a year.
The Advantage Multi, yes. So Advantage Multi, it's anti-worm and things like that.
Yeah.
The ideal time to use the worm, although in Eastern Ontario and around the Pickering area, we don't see it as much heartworm. I have seen it. The critical 6 months for heartworm is June through to November. So that's the time that we really like them on that worm preventive on top of the tick preventive as well.
Yeah.
Okay.
So.
I was going to ask you, speaking of vaccine, there's one I didn't ask about. So leptin Lyme, the other bacterial vaccine, how much dog exposure are they realistically going to have in the next year? Are they going to be at risk of picking up kennel cough or bordetella?
We attend some events where multiple dogs present. Yes, but...
So I will ask you, so it is an optional vaccine. It's something that we can do, but it's not nearly as critical as Lyme. We did not do it last year. Is it something that you would like to
No, we never probably did it, kennel cough. Only once we did it because Gabie was coughing.
Correct.
But she breathed in some poops of rabbits.
Yeah.
It's very small, and she coughed this out. So
Which
we saw this. Yeah, but we were afraid she will infect everybody with kennel cough and vaccinated all dogs around. Yeah.
And so at this point in time, then I'm going to say, based on your responses, we're going to stay the course and continue not to give that vaccine. The risk is very low. And that's the other thing as well, is especially with an optional vaccine like that, it's about having that conversation with your vet. Is this something that my dog needs? Where are they getting exposed to it? Typically, kennel cough, although as I said, the lepto vaccine is something I absolutely 100% recommend. Something like kennel cough, I have that conversation. It should be a risk-based vaccine from there, which is something that if they don't need, we don't give it, but if they do need, we don't hesitate.
But you know, even when we go to Pet Expo, for example, we choose time when it's less crowded.
That's smart, because that's exactly how they're going to get exposed. It's direct nose contact.
To get much less exposure. They have more exposure to people because, you know, everybody loves to hug them, to kiss them. So, yeah.
Good. Any other questions or concerns before I give them their vaccines?
No, not really.
We always ask before we do it because this is the next part. So we, as a clinic, always pick the same spots to give the same vaccines to. The reason is if they do have a reaction, we know exactly what vaccine they do. So this is the Lyme vaccine. It goes in at the left shoulder. And this is the lepto vaccine that's going to go back in at the left bum area here. Simple as that.
It's very smart.
And you can see they don't mind it at all. A lot of people get really worried the dog's going to react to vaccines, get painful, that sort of thing. But honestly, my experience is, especially with the right technique, good dog.
But they had a lot of vaccines already.
Exactly, they're used to
didn't have any reaction,
Good.
So...
I also cheat a little bit. I've switched the vaccine needle since pulling it up. This is a 25 gauge. It's a much smaller needle from there. A lot more comfortable. You can see. So Coco did notice that one a little bit, but it's over in a second.
It's okay.
Good.
It's okay. Good dogs. Good dogs. Good dogs.
The final part of this is we have that. So you and I have had this discussion before, but you have elected to pull what we call a senior screening profile on it, especially for Gabie. We're going to screen her liver, her kidney, her red blood cells, white blood cells, platelets, her thyroid, and her heart as well. With Coco, I'll leave it up to you. Coco's heart has screened normal in the past. I don't think that we absolutely need to, but if we put your mind at ease, I'm more than happy to. But again,
Okay,
I'll leave the
doctor,
final decision up to you.
what's your suggest to do? We will
I
do.
don't think that again, it's not about over-diagnosing or under-diagnosing, over-treating. I'd say let's stick to the senior screening profile for Coco. For Gabby, though, absolutely adding on that BNP heart stress
Okay,
test.
okay.
So it makes the most sense to me to do that.
Okay, thank
Excellent.
you very much.
Absolutely my pleasure.
No, doctor, are you ready to give a blood to doctor? For screening?
I'm just gonna go grab my supplies for